Good morning, everybody. Tales from the treatment room. Here I am. So this is a book on fascia written by an Italian guy, Serge Paoletti. And I already picked the page because this one is a different kind of book than the other one. Here I have on this page, your heart. So this would be the side of your body where your nose is. So this is your front side of your body. Here's your sternum, and obviously you can see some of your ribs, right? This green is your heart, right? Here's your aorta coming off your heart. Here's the vena cava that brings blood back to the heart. We are obviously looking, not obvious to you, but to me, we are obviously looking from the right side, so the right side of the body's cut away here. But the important part for us is this. This is your respiratory diaphragm. This is the dome of your respiratory diaphragm. Look at this very strong ligament. I kind of wish they did it in a different color. But look at this very, very, very strong ligament that's here on the bottom of the heart that attaches to the respiratory diaphragm. I also want you to notice this is a ligament that attaches the heart and suspends it in front of the sternum. So you have these sternal ligaments, one here and one lower, one more inferior, one more superior right there. You then have ligaments. Now, of course, this is the pericardial sac that's around the heart. So this is representing the sac, not the heart. The heart is inside. And of course, that sac is fascia, you guys. Just because it's named something different doesn't mean that it is something different. It's fascia. So it surrounds the heart. It's ligamented to the sternum, to the diaphragm, and here's the super interesting thing. This ligament going up actually attaches into the vertebrae of your neck. So your heart is actually, and there is actually a ligament going backwards that you can't see. Also, the esophagus, you can't see that. Maybe tomorrow I'll pick a picture that shows all of the relationships to the different layers of everything through. But today, this is about how the heart is ligamented to all these places. And the ligaments that go up to your cervical spine are here. And the interesting thing is, so what happens when I have a whiplash, when anybody has a whiplash, what happens is the heart gets pulled upwards, doesn't it? So, of course, your respiratory diaphragm is also going to get pulled upward. So I want you to know that these guys are really susceptible when you have a car accident. Most people don't put that into the equation of what has to be helped to be healed during after a car accident. You know, chiropractors are adjusting the cervical spine and probably adjusting the rest of the spine down the back and into the low back. But what is happening to the contents? You know, that's one thing I teach my students. You have to think about container. Here's the container, right? Your thorax with the ribs and the sternum and vertebrae are container. This is contents. So what happens to the contents during whatever issues? In this particular example, the car accident that pulls the heart higher, takes the diaphragm with it. Then what happens is you end up with tension on the heart until this is resolved. Of course, this is something I teach very late in the school. Like, we're a 2-year, 2-month school, and probably the last or second to the last module of mine is actually how to treat the heart and how to treat it for things like this motor vehicle accident, what happens with it. So you guys have a great day. Thanks for listening. I appreciate you all. Talk to you tomorrow.